Distinguished colleagues, esteemed podium, it's my greatest pleasure to see so many colleagues of ours in this audience. First of all, I would like to recollect our mentor, Professor Mauri Lepontalo, who actually was in charge of the department. I used to be a president of the Scandinavian uh, Society of Vascular Surgeons and the European Society of Vascular Surgeons. And he's the one who introduced us to our current partners at his faraway conference. So we got to know each other and decided, well, let's go ahead, maybe something will happen. We'll meet each other again. And Anders actually suggested, like carrying out a small workshop seminar, in order to establish friendly relationships. And that was just an idea. And that small workshop, turned out to be such a great conference. In my presentation, I would like to commemorate, the people who made things happen, who set up the department we are talking about today. First and foremost, this is Professor Alexander Barsukov, who attends our conference. For 20 years in a row, he was a chairperson of General Surgery Department, again, who was a mentor of other surgeons at MED122 Academy. And the majority of our staff actually started their career at the Department of General Surgery. I cannot not mention Professor Thomas Edward Topper, who we got to know back in 2000. He visited our unit at the MED122 Hospital, helped us master new novel techniques. I'm lucky we worked together for about a year, and the majority of techniques we use now, in fact, were taught by this outstanding surgeon. And he was like he became best vascular surgeon of the United States in 2006. Unfortunately, he has passed away in 2009. Now, I would like to recollect Dr. Valery Yelsinovsky, who was in charge of surgical services of the Hospital 122 before Viktor Kashenko. And then he assumed the responsibility for the ambulatory surgery center. And prior to that, we even didn't have such a service line in the Hospital 122. Without any doubt, we started growing, and we needed already like the inpatient units. And now I would like to acknowledge the role of the Dr. Vaja Toidze, head of the second surgical unit. And without any doubt, I ought to recollect our head doctor, who is not with us today, Dr. Yakov Nakatis, who used to be an ideologist of vascular surgery, who contributed to setting up the center, vascular surgery center. Of course, those traditions that were touched upon by Professor Albeck are great, but we cannot brag about traditions a lot. Just because, we set up our service in 2007, and the vascular surgery unit was established in March 2012. That's our team. What's important? Again, I would like to refer to Professor Kashenko's speech. Interdisciplinary approach is a matter of the great importance. So we, in fact, worked and collaborated closely with cardiologists, and we seek their consultations on everyday basis. Basically, we enjoyed online consultation. Plus, we need angio neurologists without whom we just cannot perform. We need their consultations again, and we need, there's workup skills. And now I'd like to acknowledge Professor Kaumov. Also, I would like to mention to you our scientific potential. We have 4 doctors of medical sciences and 5 candidates of medical sciences. That's about our surgical activity. I was also impressed, by our Finnish colleague, like 5,000 operations a year. But I must admit we don't have any emergency surgeries, so we just perform elective surgeries. But we are growing as well. We started with 144 operations, whereas last year we performed 846 elective surgeries. At the same time in our hospital, so we perform almost 2,000 operations on the vessels and the heart. And what else is very important? Our department is a base for 2 chairs or departments of general surgeries and vascular surgery of our Northwest Medical University in the name of Mechnikov. So we have residents and interns, so we're trying to teach them everything we are capable of ourselves. And as our Viktor Kashchenko mentioned, we cannot, imagine our work without the international contacts, and our current conference is an example of that. So we have great friends in Helsinki, Salzburg, Boston, Zurich. Also, we are visited by leading doctors, the doctors of this outstanding clinic, and then we visit them and master new techniques there. The priority areas. Ischemic stroke prevention, and it's not by chance we devoted our conference to this issue. Another important area we pay a lot of attention to, and the vascular treatment of aortic aneurysm, and the combination of hybrid operations on lower limb arteries. Again, so we cannot work without our colleague phlebologists, and the same situation is in Finland. We don't have this wonderful hybrid suite Andres talked about, but we have a set at least, and we use this angiography set for doing complicated cases, and I'm going to present a couple of cases to you. That's an aortic aneurysm, and it's again a combined operation, and the outcome of this on CT scanning 1 year after. Another observation, that's and the grafting of the abdominal aorta aneurysm, and dissecting aneurysm of the descending portion of the thoracic aorta. Another area of our work, again, a hybrid method. In this case, actually, we perform thrombectomy, perform balloon angioplasty, a stenting of the arteria iliaca externa. Restenosis after eversion technique, another area that also plays an important role in our work. Angioplasty of the artery, lower limb artery in case of diabetic foot. What else is important? It's not a very joyful slide. But again, so we do benchmarking. In the United States, about $3 trillion US, like 18% of GDP is allocated for healthcare. We unfortunately cannot spend so much. And in fact, the government of the Russian Federation reduces allocation for healthcare. It's 4.2% of GDP. And what about prevention? How much do we spend on prevention? Not a lot. As a rule, we just treat the diseases or complications instead of preventing diseases and promoting health. So we believe that prevention of various diseases, including prevention of stroke, is much more cost effective as opposed to treating these diseases. Plus, so like modification of modifiable risk factors and concentration of high tech. I'm going to refer to Woody Allen. uh, the brain is an important organ. That's why we set up the stroke prevention center, like that in Massachusetts. And the major goal of this center is primary and secondary prevention of ischemic strokes. Etiology, concentration of highly qualified specialists, their consultation before and after operation. That's actually a dynamic diagram of the center. That's vascular surgeons, interventional radiologists, neurologists, cardiologists, all these professionals and pieces of equipment work um, for the center, and that's how we believe we have to achieve success. Oh, we heard of nurses who do ultrasonography, who do ultrasound in Finland. Oh, well, in our environment, doctors in charge of, ultrasonography, um, including not limited to identification of defect. That's actually a very simple technique. That's a cerebral oximeter, and we cannot think of working in our ORs without this device. We use it online, and by virtue of this system, we practically managed to reduce number of complications to zero after carotid surgery. What is the perspective of our work? We believe it's endovascular surgery for aortic aneurysm, and we gain already a great deal of experience of endografting over 200 operations with 0% mortality. What else is important? Evaluation of immediate and delayed outcomes of open and endovascular interventions on the abdominal aorta, and the grafting with the use of various fenestrated branched graft. And without any doubt, what else is our future? But over 30% of our interventions are endovascular, endovascular nature, plus hybrid operation. Plus, we have like a scientific agenda. We are going to use CT scanning, a multi-energetic CT scanning for medical biological research, and studying molecular mechanism of atherogenesis with the use of labeled nanoparticles and biomolecules. To conclude, I would like to outline the philosophy of the future. As a matter of fact, as a philosophy of our time, the new century brought new reality in shape of converging traditional surgery to endovascular. Plus, again, the creative approach to treating each and every patient with consideration of critically analyzed contemporary recommendations, personal equipment, local conditions, and in fact, this systematic and lifelong treatment of atherosclerosis should improve quality and quantity of life of vascular surgeon. I would like to conclude with this slide. Actually, it's a favorite slide of Dr. Lepontala. That's it represents the success of our